Hey guys, it's your girl J Antoinette and welcome back to another video. So in this video today guys, we are going to be talking about bacterial vaginosis and we're going to get into depth about everything about it. So if that is something that you're interested in, don't forget to give this video a thumbs up. And if you're new here, welcome to my channel. I do a whole host of content, mainly lifestyle content. So if that's something that you're interested in, give my videos a thumbs up. And also, when you're done all of that, click that big red button that says subscribe. Thank you so much for your love and your support on my channel, guys. And without further ado, let's get straight into this video. Alright guys, so as I said, we are going to be talking about bacterial vaginosis. Okay, so bacterial vaginosis is a type of infection that can cause inflammation in the vagina due to an overgrowth of the good bacteria that you have in the vaginal area. All right, so because of the overgrowth, it basically disturbs the balance within the vagina, throwing off the pH and hence giving you this infection. Now, bacterial vaginosis is frequently seen in women who are mainly sexually active. Okay, so we're going to talk about symptoms and we're going to talk about everything, guys. So I know a lot of women have experienced this before, but not necessarily know what they were having or knew what was going on with them. So yes, this is bacterial vaginosis. If you have an overproliferation of bacterium in your vagina, you do get these symptoms as follows. So one of the main symptoms to look out for if you're having bacterial vaginosis is that you will have a very thin gray discharge. So if you're noticing a thin gray discharge on your panties or on your panty liner, it could be a possibility that you have bacterial vaginosis. If you have a very fishy or foul smelling odor coming from your vagina, it is possible that it could be linked to bacterial vaginosis. And if you're having vaginal itching or burning during urination, those are also linked to bacterial vaginosis as well. All right, so those are all of the common symptoms that are found while having bacterial vaginosis. Now, when should you see your doctor? It is important that you consult your doctor if you are having the odor consistently. So if you are having this odor longer than 2 to 3 days, you most definitely need to go and see your doctor. Now, at any time, if you're having a vaginal odor, please consult your doctor. And as I normally do on my health videos, guys, I am not a medical doctor. I am a medical professional and I can give information, but if you are not sure about what I'm saying, please don't forget to consult your doctor about everything that I have said to you. Okay? All right. And other reasons that you should go ahead and visit your doctor is if you are constantly having these infections. So for example, if you have these symptoms, you get a treatment from your doctor and it gets better, and then you notice that it comes back right afterwards, you most definitely need to go and see your doctor. Okay, now some of the causes of bacterial vaginosis is having very multiple sex partners or having sex with a new partner. Now this happens because when you increase the partners that you have, there are multiple different types of bacterium entering into your vagina, especially if you're not having protected sex, and this can also lead to an overproliferation of bacterium in the vagina, and hence because of that you can't get rid of the infection because you're infecting yourself with different types of bacterium. So those are one of the risk factors or causes. Douching especially is one of the causes, guys. It is 2021, no douching. If you want to feel an extra clean down there, even though the vagina cleans itself, I do suggest that you try a hip sit bath with apple cider vinegar. Okay, and as I said before, you don't necessarily have to do that because the vagina does clean itself. All right, and also another risk factor is if you just have a natural lack of lactobacillus within your vagina. Now, if you don't know what lactobacillus is, it is a gram-positive bacilli that is found in the vagina. in women of childbearing age. Mainly, yes, it can be found in the woman's vagina. Before, I think it's when you get closer to childbearing age that it is seen more. So if you have a lack of that good lactobacillus within the vagina, it can cause you to become more permanently, or you're more prone then to have bacterial vaginosis. Okay. All right, so some of the complications that are linked to bacterial vaginosis is preterm birth. Preterm birth is basically going into labor before time. Okay, sexually transmitted infection. So if you've had a history of having like either HIV or any other sexually transmitted infection, it is possible that you can get bacterial vaginosis as well. That's a complication that can arise from it. Yes, and pelvic inflammatory disease. All right, so some ways to prevent getting bacterial vaginosis is to minimize the amount of sexual partners that you have. And if you are going to have multiple sexual partners, it is important that you are using a barrier contraceptive in order to reduce your risk of getting bacterial vaginosis. Okay, do not douche. As I have said before, guys, it is 2021. We do not need to be putting anything into the vagina to clean it. It is a natural cleaning agent. Your girl cleans herself, so you don't need to put anything in there to clean it. All right. And also minimize vaginal irritation. What do I mean by that? Minimize putting deodorant sprays or scented soaps or scented tampons and scented panty liners around that area, because it does increase your risk for getting bacterial vaginosis. Let's talk about how it is diagnosed and also some treatments that you can get to help you with relieving yourself from this. So basically, you are diagnosed by a pelvic exam, which majority of the infections that women face, you are basically diagnosed by getting a pelvic examination from your doctor. So what your doctor will basically do is she'll take off a sample and she'll send it to the lab. All right, so one of the main things that the doctor does look for when a sample is sent off to the lab, they look for something called clue cells, which are vaginal cells that are covered in bacteria, right? That is a primary sign of bacterial vaginosis. And they can also check your your pH, which your pH is supposed to be acidic. So if your pH is a little higher than that, then it is a sign that you are having a bacterial infection. All right, so some ways that it is treated, mainly they do give you antibiotics. Now, if you're a person who does not take conventional medication such as antibiotics, there are some other treatments as well. Okay, so just hold on a minute. So one of the main treatments that they will give you is something called metronidazole, which will just clear everything up, and then you will be on to your merry own way. All right. There are other types of antibiotics like clindamycin as well that they do give you to clear infections. So mainly in terms of conventional ways, the only way is to take an antibiotic. But in a case where you do not want to be taking conventional medication, I have talked about this on my channel before, boric capsule suppositories, guys, that is going to clear your infection very fast. So for example, if you have the discharge and the odor say today and you put your insert in tonight, by tomorrow you will notice changes. My only thing about boric acid capsules is that do not overuse and abuse it, because there can be some serious complications from it if you are abusing the use of it. Okay, so only if you're really having complicated infections that you cannot get rid of, I advise that you can use it in that case, but don't overuse boric acid capsules. Okay. Another one of the very natural remedies that I always hear and see people talk about is hip sit baths. But in this case, it is not with apple cider vinegar, sorry. I don't know if anybody else has seen this before, but persons naturally would do a hip sitz bath with a little bit of hydrogen peroxide. Now, if you don't know what hydrogen peroxide is, it's basically what our parents used to put on our cuts when we used to go outside and fall off our bikes or fall down the hill or whatever, right? So it's that little, it's like, it comes in a little nice brown bottle. You can't really see the liquid itself. So it's a clear fluid. You just put a little bit into your water that you're gonna have your hip sitz bath in, and you sit in it. And naturally, because of the action that it does when you actually when it comes in contact with bacteria, you will see a little bubbling going on. But persons have said that it has helped them a lot, especially for women who have chronic bacterial vaginosis. So these are some of the natural treatments that you can use if you are a person that does not use conventional medications. And as I said before, guys, anything that I say, you can take this information and consult your doctors about it as well. And also I give this information so that it's a little more enlightening for you to talk to your doctor when you go to her, when you are having these problems, so you can, you know, have a better conversation and get more time for your money. All right, guys, so I hope this video was very helpful. I hope it helped very much, and I hope that if you are currently going through an infection like this, that these treatments will help you to get some fast relief. Boric acid capsules, I will not reiterate it enough, guys. It will clear your infection fast. All right, so I hope that this video was helpful. Thank you so much for tuning in and for watching. I love you all so much. Bye, my loves.